Everyone has a story, a critical explanation of narrative theory. We're going to look at several facets of the narrative theory today. What is it? What's the main concept? Who can benefit or utilize narrative theory? Some background in history, the operant concepts of the narrative theory. What are the strengths, limitations, or vulnerabilities? And of course, some research and examples of narrative theory and how we're using it today. So let's delve right into it. What is narrative theory? Well, narrative theory is an approach to social work based on the concept that people convey information about their past and present lives through storytelling. It's easier to ask a person a question and have them tell a story than to try to just gather facts. And of course, narrative theory is a brief treatment modality that can be completed in as little as 7 or 8 sessions, but it's not limited to that time frame. In other words, we can take more time if necessary. So the central or main concept of narrative theory is the fact or idea that I can ask a client a question, and in fact, I can just say, tell me your story, instead of asking a whole bunch of individual questions to try and glean some information. They'll tell me a whole lot more about what's going on if I just ask them that simple question, tell me your story. And of course, this information is going to allow me to aid the client in a much better way. So now we ask who benefits or who can utilize narrative theory. Well, the narrative theorist works with a wide range of client groups that could include people who are having problems with delinquency, like childhood conduct problems. Maybe they're staying away from school because of bullying, child abuse at home, grief reactions. Maybe something horrible has happened in their life, and we can help those groups with that. Uh, the mass shootings that are going on now, schizophrenia. And the people within these groups, the clients, include the children, their families, can be used with a wide range of racial, ethnic, or all age backgrounds, and of course, a very wide and diverse client range. It makes it very dynamic. So the background, history to narrative theory. Well, narrative theory was fully developed in the 1990s, although work started with its creators, Michael White and David Epstein, back in the 1980s. The Vygotsky theory was the basis to the narrative theory. This theory is a large component of family therapy, and of course, the highlights of storytelling is essentially to separate the person from their problem. Instead of, I am my problem, this is my problem over here. I can talk about it separate from me. So it works hand in hand with what social workers usually do, and that's asking open-ended questions to prompt the storytelling. And of course, narrative therapy is the therapeutic practice that is grounded in the theoretical assumptions of narrative theory. Operant concepts in narrative theory. The narratives are inherently subjective, so the speaker may leave out some details of a story or emphasize other details or the sequence of events to further bring home their point. And of course, with the appraisal, the process where the storyteller attaches meaning to various instances of his or her life, this helps us find out what are they actually concentrating on. Now, of course, all the events of a person's experiences can be understood with multiple interpretations. This is called multi-storied. So the same story can be told different ways, with different parts of it being emphasized at different times. So what kind of an impact can society have on the way a person understands or what their beliefs are? This process of internalizing a societal belief by an individual is called social construction. In other words, the society inculcates its members with powerful underlying beliefs, and these beliefs are called dominant narratives. This is where a person's story becomes not totally theirs, but it's based on what society has thrust upon them. So just a few of the strengths of narrative theory can include sharing stories being seen as meaningful. So we let the client know that it is meaningful. So we're not so much concerned with the issue at hand, but the background that created the problem. The main focus, of course, is always social justice. For young children, artwork and bibliotherapy are super concerned with how social construction affects those who are oppressed. And of course, it's easier to give validation and self-compassion to the client through narrative theory. There are vulnerabilities of narrative theory because it doesn't have to follow the guidelines of being evidence-based. Well, there's not enough evidence to be evidence-based practice. The theorists, of course, are against utilizing the DSM-5. They don't like to diagnose the clients. Now, when a client is telling their story, sometimes they don't remember all the details, and at other times they may add extra details to support their own thoughts at the moment. It doesn't fit well with managed care, and there's no therapeutic interventions associated with working with the client in the guidance process. Now, when it comes to trauma, there's more success with other practices such as CBT. Now, some of the examples of narrative theory in practice, society may teach impoverished immigrant youth that their future isn't at all promising. Now, when these type of interpretations come into a story that a client is telling, they may become elevated. So a social worker can intervene with the narrative therapy by listening to the client's narrative, then deconstructing what the client was talking about so they can discuss the roots of the problem or the belief system and examining the veracity of these roots. Also discussing with an impoverished immigrant youth if it's at all possible for his future to be bright. Part of the deconstruction process, the social worker can help the client externalize the conflicts so the client can separate himself from the disempowering and negative thoughts instead of viewing these thoughts as the external force to be combated. For instance, the social worker can say, substitute I'm depressed with I'm battling with depression. So we look at a research-based analysis, example of comparing narrative therapy against cognitive behavioral therapy. The narrative process uses the client's language and integrates contextual factors that might have an impact on life and career decision making. Now, when looking at the depressive individual for trying to reduce the depressive symptoms, um, the CBT group actually did show a significant larger decrease of depressive symptoms after treatment and a larger portion of treatment responders. Now, several of us as cohorts tried to put a connection of narrative theory into our internships. Megan Ferreira, she said, working for DCF, many of the families come from different cultures, trauma histories, and parenting styles that attribute to the neglect charge. Hearing these stories helps social workers find the correct services and programs to provide the families. Without their stories, families are broken up and parents fear the system. Now, Zahava Schneider said, I work in an agency which assists young families in which a parent has been given a life-threatening or terminal diagnosis. Letting these young parents and their children tell the story as they see it allows us to hear what they perceive their needs to be. Personally, all the veteran clients that we work with have a story that they want to tell, and this helps us to determine better how to help them. So summarizing what we've gone over today, what is narrative theory? It's an approach to social work through storytelling and a brief treatment modality. The main concept, the client story can give the social worker a bevy of information. Now, who benefits or who can utilize narrative theory? There's a tremendous range of issues as well as clients who can benefit from it. Some of the background and history fits hand in hand with the social workers' open-ended questions and was developed and refined in the 1980s and 90s. The operant concepts, narratives are inherently subjective, and storyteller attaches meaning to various instances in their life at certain times. And of course, society impacts the cognitive process and inculcates its members with powerful underlying beliefs. So some of the strengths, limitations, we went over those. Sharing stories can be seen as meaningful, but it does not fit well with managed care. Some research and examples of narrative theory uses clients' language and integrates factors that may have an impact on the client's lives. Now, although not complete, analysis shows CBT to be superior in some cases, but no better in others. We do have our references, but I want to take this moment to provide the most important reference, and those are my cohorts. A great deal of work went in to presenting this assignment. First of all, I want to thank Megan Ferreira Renshaw, Lisa Monville, and Zahava Schneider. I have narrated this. My name is TJ Blake, and once again, a great deal of thanks to my cohorts. And our additional references.